Well, the government agencies that oversee U.S. airlines are taking a new look at their mental health regulations for pilots. This comes after an off-duty Alaska Airlines captain allegedly tried to turn off the engines of a plane mid-flight. The National Transportation Safety Board convened a mental health forum yesterday to examine what needs to change. Our Kris Van Cleave has more on this. Kris, good morning.
Good morning, Anne-Marie. The witnesses told the forum that, and the witnesses include pilots, I should say, told the forum that they feared reporting problems because of the potential they could be grounded for good, essentially left unable to make a living. They say they feel that the FAA rules have created a stigma around mental health that presents a safety risk.
19-year-old student pilot John Hauser was struggling with his mental health in silence for months, fearing seeking help would lead him to losing his FAA medical certification required to fly. He took his own life by crashing this plane in October 2021.
John did not have a known history of depression.
His mother, Ann Sue.
In a letter describing the turmoil that John was silently facing, he wrote, "I want to seek help more than anything. I just know if I try, I will have to give up on aviation. And frankly, I'd rather not be here than to do that."
Disclosing mental health issues can lead to a pilot being grounded by the FAA. United Airlines First Officer Troy Merritt grounded himself a year ago to get treatment for anxiety and depression. He says he's taking an approved FAA medication, but it could take another year out of work before regulators allow him to fly again.
Had the barriers that are in place today not been there, I know I would have sought treatment earlier.
One study found more than 56% of U.S. pilots avoid seeking medical treatment out of fear of losing their FAA certification to fly.
We got the message loud and clear from all sides. If you want to fly, you can't admit anything is wrong.
Court documents say off-duty Alaska Airlines captain Joseph Emerson allegedly took psychedelic mushrooms 48 hours before he attempted to turn off the engines of an airliner in mid-flight, reportedly telling police he'd been battling undiagnosed depression. He's expected to be arraigned today on dozens of charges, including 83 counts of reckless endangerment.
Choosing between lying and flying without seeking help, that's not a choice.
Following that October incident, the NTSB called this first-of-its-kind mental health forum. Board Chair Jennifer Homendy.
It sounds like from where you sit as the chair of the NTSB, the existing regulations aren't good enough.
The existing rules are arcane. At the very least, pilots and others need to be able to sit down, talk to a therapist, and not worry about the impact on their jobs.
The FAA says it does provide a pathway for pilots to return to the cockpit, but ahead of the forum, the agency announced a panel to review existing mental health regulations. FAA Administrator Michael Whitaker.
We need to have a system that allows people to be more forthcoming and to have treatment for issues that shouldn't keep you out of the cockpit.
Now, the FAA has conducted similar panels in the past that brought about little change. A 2016 Harvard study, so pre-pandemic, found as many as 1 in 8 pilots could be clinically depressed. This morning, the nation's largest pilot union is joining the call for change, saying the current system is outdated. Anne-Marie?
That is really actually concerning. Clearly, there's a culture that needs to change, but I don't know if you can change culture through policy. That's the question. Can we talk a little bit more about why pilots feel like if they come forward with a mental health problem, they could find themselves, grounded permanently? The FAA's own website claims that only, 0.1% of medical certificate applicants who disclose health issues are denied. So at least according to, their website, they're very open to helping people. But I guess in practice, pilots don't feel that way?
Well, I think what's important there to note is that come forward. Every pilot I know, and I talk to a lot of pilots in this job, can tell you an example of a colleague who reported a problem and then was out of work, grounded, had their medical certificates suspended or pulled for years, and in some cases were disqualified essentially from flying because of medication that they ended up needing to take for their mental health. So there is a real concern amongst pilots that if you report something, that it could get flagged on your next medical and either see that you're temporarily or in some cases permanently grounded because you sought help for an issue or you reported seeking help for an issue. So the NTSB chair in particular, her concern is that that 0.1% number probably isn't an accurate measurement because the vast majority of things go unreported, and we know that mental health it tends to be unreported anyway.
Mm-hmm. Have you spoken to pilots about the pressure that they are facing? We've talked about air traffic controllers and how stressful the job is. What about pilots?
Yeah, so speaking with an American Airlines captain yesterday, Dennis Tazier, who is a spokesman for the pilots union at American, and he says that the pilots are feeling the pressure still. You know, coming out of the pandemic, there's been a lot of churn through the system. You have people, you have captains on new airplanes, you have new first officers on airplanes, you have a huge demand in travel. You know, travel snapped back and now is at record levels. So pilots feel that pressure. You know, the pandemic was also hard on the nation's mental health collectively. Mm-hmm. Pilots are people too, so there certainly are people that are feeling the pressure, and there are clear calls inside the industry for some change. You know, I was talking to a pilot who expressed concerns about whether or not he could go to couples counseling because if that got reported to an examiner, he worried that could get him grounded.
Wow, Kris, really fascinating. Thank you so much.